Hello, beautiful mamas. Welcome to the Balanced Momma Project Radio. Today, hi, I'm Dr. Say. I'm here. And then Dr. Val is also present. Thank you. And we also have a special guest, Dr. Sha'llah Brewton. She is a family medicine physician with an intense focus in women's health. She is the founder and chief medical officer of SBMD Healthcare. And so we're going to dive a little more into what SBMD Healthcare is coming up. But just so that you know, Dr. Brewton is committed to collaborative approaches to care, and she loves working alongside her patients rather than directing from above. And so we love her. She prioritizes empowerment, patient education, and shared decision-making, and make sure to help each individual take an active role in their health journey and sustain their most thriving, balanced selves. And so, hi, Dr. Sha'llah. Thanks for joining us.
Thank you for having me. Yes, I'm excited.
Yay! We're excited to have you. I know we're going to get into early postpartum care, things to look out for in a little bit. But before we get into the deep topics, can you tell us how long have you been a physician and what's the best thing about working with the maternal health population?
Yeah, so I've been a physician since 2011 when I graduated med school, and I've been practicing since 2016, since starting residency in 2016. My favorite thing about working with the maternal population? Well, I love empowering women and making sure that they're listened to and feel heard and respected within their healthcare journey, right? Whatever that may be. And not just the maternal aspect of women's healthcare, but all throughout menopause and earlier reproductive life, but just all of women's healthcare is just one of my passions and just something I've always loved to do and to help women with, especially women that look like me, because there's not a lot of doctors that look like me. And I know I always like to, when I'm looking for a doctor, I search out Black women doctors. So I like to be that familiar face for people, that familiar cultural face for women to be able to go to for their healthcare as well.
Yeah, that's awesome. I think that's anecdotally what a lot of us do, right? Is try to find a provider that looks like us, that maybe has shared experiences, but then also research even shows that, the racial concordance between provider and patient leads to better patient outcomes, leads to better health in general, leads to better buy-in from the patient. So better trust and rapport. And so it can improve health overall. So that's amazing that you are a provider that is really passionate about empowerment and listening to your patients, and promoting women's health in general, and then also really specifically also really looking out for Black women's health as well. So awesome.
Yes.
The other thing I was going to say, the other thing about maternal health and postpartum care that I love is that you also get to see an aspect of the woman's life that's even deeper. Like you get to hug and love on their babies and help the newborns also have a healthy start in their life as well. And just you get a bigger picture of the woman's health in general, because health is not just like, your blood pressure or your pulse or, those more physical signs, but it's also emotional and social and cultural. And so being part of like the maternal care team helps just to get even closer to the woman and know what her needs are and be able to form a even kind of a closer bond and be able to care for them better.
Mm-hmm.
So
I love it. I was gonna say, even when you said seeing like a closer look into people's lives, I think one of my favorite visits is when I see the mommies like fresh out of postpartum with their new little snuggly, and I'm like, "How you doing? How's
yeah.
tiny one? Do you have photos?" This is if anybody is out and about, and I don't see tiny one. I'm like, "You have photos?" And the answer is always yes. Um,
1,000.
yes,
Yes.
the 1,000 photos and 1,000 memories, even from the first 5 days.
Right.
For real, for real.
It's so true.
And then, oh, go ahead, Val.
You got it.
I was gonna say it isn't. I'm always curious to hear from the physician's perspective, because I was like, yes, I'm a PT, so I have one lens, but I'm like, each lens of healthcare looks a little bit different. But I'm curious what your thoughts are on typical like early postpartum care in the US. Like, what are your thoughts about what it looks like and what it should look like? Because I know you are passionate in this space, so I'm just curious.
Yeah. So postpartum care in the US, it honestly can look a little bit differently depending on where you live in the US. And so, but for most of us, what we have like, I think, come to know is that like 6-week postpartum visit, right?
Mm-hmm.
You have your baby, and of course, immediate postpartum care. If you're in a hospital, it's in the hospital. You're there for 1, 2, or 3 days, depending on how your delivery went, if you had a C-section or not, and you have very close care, right? Like you got hands on the baby, you got hands on you, you're getting very well taken care of, right? Then you go home and you don't have another doctor's visit for you for 6 weeks. Maybe
Right.
it's 4 weeks. Maybe if you had a C-section, it's 2 weeks because you have to do an incision check, right? And then you'll have another one at 6 weeks. But usually it's 6 weeks. ACOG, which is the American College of Obstetrics and Gynecologists, they in 2018 have changed their recommendation to more frequent visits. So they suggest that the first visit be within and I'm talking about postpartum visits now, the first visit be within the first 3 weeks after birth. And
Love
then you
it.
should have additional visits scheduled as needed, and a final checkup no later than 12 weeks after birth. And that's because those first 12 weeks are really important. It's a really critical and kind of vulnerable time, both for mother and baby, but we're talking postpartum now. So for mother, that where complications can arise and things that, because of the woman's postpartum state, things could come up, and them being the health being checked more often is really critical to catch things earlier rather than later. And what that translates into as far as visits is like sometimes you'll have that 3-week visit and you'll have the 12-week visit. Some people are still having that 6-week visit and just the 2-week visit. If you had a C-section, a lot of people are still just having that. And I think a lot of that also has to do with, even though ACOG, and not only ACOG, there are a million, I shouldn't say a million, I'm an over-exaggerator, sorry.
There's still a lot,
There
though.
are a lot of other regulatory bodies that confirm how important it is to have more frequent visits for a mom's recovery from birth, right? So the Academy of Breastfeeding Medicine, the American College of Nurse Midwives, the National Association of Nurse Practitioners in Women's Health, the Society for Academic Specialists in General Obstetrics and Gynecology, and the Society for Maternal Fetal Medicine all endorse ACOG's statement about the importance of having more frequent visits. And the AAFP, which is the American Association for Family Physicians, also agrees with ACOG and goes along with those guidelines. And depending on, they actually also suggest a 1 week visit just to check blood pressure, right? So that's how important blood pressure and possible hypertension after pregnancy in the postpartum period is, because it can just kind of come up without you knowing, without having any symptoms, and waiting until that 6 week visit can be detrimental. So more frequent visits should happen. World Health Organization is also another important like regulatory body for medicine in the world and in this country as well. They suggest visits at day 3 postpartum, day 7 or 14, and the 6-week postpartum visit. So they're also suggesting more frequent visits than are regularly had here. I agree with the more frequent visits. I trained, where I went to med school was in Cuba, and Cuba uses the World Health Organization recommendations and also does home visits. So for that 3-day and that 7 to 14-day visit, they're in the home and you're visiting the mother and the baby at the same time and doing their checks and their evaluations in the home, where the mother does not have to come out, the newborn does not have to come out, and they're taken care of there. And that is the model that is like closest to my heart and that I believe in and think is like the most beneficial for the family.
Yeah.
Can I tell you? Oh,
Go ahead. Go ahead.
well, I'll shift in a moment. Can I
We're
tell
so
you?
excited.
I love the statistics. I was like, let us know what days they recommend for the early visits, because I'm like, yes, mortality rates are so high so early in postpartum. And so I'm like, people can't afford to miss the scaries. And I know we'll get into that, but it made me smile also thinking about when you're like, yes, home visits are near and dear to my heart, because I'm like, I can't imagine majority of folks want to leave with their baby carrier, with their supply bags, and trying to maneuver, whether you've birthed via C-section, whether you've birthed your child vaginally. Yeah. I just can't imagine, as your body is recovering, you're trying to go out and about, run to an appointment on day 3, run to an appointment on day 7. It seems much more convenient to have it in your home. And I think it is it's an interesting thing to note that, because I'll see moms postpartum now and I hear a pretty standard 6-week visit, that even though the recommendations changed in 2018, it sounds like healthcare is still catching up a little bit.
And a lot of that, I think I might have started to mention this and didn't follow through. I go off on tangents often, so you bring me back in if I do.
That's all right.
Insurance.
I love tangents.
Insurance is the slowest to pick up on these changes.
Insurance
because until laws are changed, they don't tend to change, because a lot of times it means they have to shell out more money, right? So one postpartum visit is one thing to pay for, and now if you need 2 or 3, they are going to have to pay more. A lot of insurance are still just covering 1. And so it's really important. I'm a big proponent of following what your provider suggests. If your provider suggests you need 2 or 3 postpartum visits, then you go to those 2 or 3 postpartum visits. But
Absolutely.
Also, during your pregnancy and before baby gets here, call your insurance company and find out what is covered, so that you at least do not have completely surprise bills popping up, right? So like, if they only cover 1 postpartum visit, that's all they're going to cover, right? No matter how much you get blue in the face talking to them on the phone, that's all they're going to cover, right? So try to eliminate the stress of that after the fact by knowing beforehand that, yes, this is going to be a bill. Start saving for it now. You know what I mean? Like, just know what you're coming up against so that you can get to it like in the most, what's the word I'm looking for? The easiest way possible, right?
Yeah, absolutely. But I mean, you make a good point. Like, there's nothing immediately postpartum is not the time where anyone wants to experience additional stress, but finances can absolutely be a stressor immediately postpartum. You're receiving bills from this, that, and the other, and especially depending on when in the year you've birthed, right? Because deductibles may or may not have been hit, and there's so
Right.
many different factors.
Right.
Um, and so it is important. Someone gave me that exact same advice to go ahead and plan out and know what is coming up postpartum financially so that
Yeah.
we could, like you said, save for that. And that's really big. And I was thinking, just as you were talking in general earlier, about how postpartum care just drops off. And so, first of all, I have to shout out all of the advocacy policy gurus in our respective fields, because they
Yes.
do that work. They go to Capitol Hill, they are talking to legislators, and we need that,
Yeah.
because you're right, there's not going to be any momentum or movement if we don't get the laws changed, which then changes insurance. And it is a fight.
It
It is a
is.
fight. Reimbursement is a fight. So
Mm.
anyway, I could go on a tangent about
Yes.
that. But I also was thinking earlier as you were talking, yes, there's so many visits. I remember at the very like third trimester, I was like, can I get out of a doctor's appointment without having to go into another one? It's so many back to back.
Yes.
And then it's postpartum, and you get silence, crickets, until that 6 weeks. And so
As if you didn't
um
just have a human come out of your body.
and that's my point, right? Because
At least.
exactly, because the thing is, you think about it, our health changes drastically as we're growing a human. Drastically, your health
Yes.
changes. But you also have 9-ish months to grow and develop and change gradually. And
Hmm.
then in the blink of an eye, you have completely shifted again,
Right.
and your health has completely changed again. Your fluids are different.
Right.
There's so many things that are different. And then, so like when I think about 3 days postpartum, 7 to 14 days, I'm like, yeah, that that makes a lot of sense. And so when we think about our birthing people, our mamas postpartum, if for some reason someone out there is like, I just need to know what to look out for, what would you tell them? What are some major vital signs that they could monitor and be aware of?
Yeah.
Particularly, we'll start in postpartum because that's where we are in the conversation, but you can
Yeah.
also touch on pregnancy as well.
Okay. Okay. Yeah. So there are a few vital signs that I would say are important postpartum. Definitely. Um, Blood pressure, temperature, heart rate, and even though lochia or the postpartum bleeding is not like a vital sign, it is a vital sign that if there are abnormalities with it, will tell you things about how your postpartum period and your healing from birth is going.
Mhm.
So that being said, I don't want anybody to think that they have to constantly be monitoring their blood pressure, their temperature, their heart rate. Yes, the lochia, that one, blood is
Yes.
coming out. You should be That's like it's a constant thing.
Mhm.
You should monitor it, and we'll talk about a little bit more what it's supposed to look like and everything.
Yeah.
But like the other ones, the blood pressure, temperature, and heart rate, you don't necessarily have to monitor it.
Mhm.
Okay. And there's a lot of different it's a I say controversial within quotes because whether or not like you should have a blood pressure monitor at home is a little bit controversial, meaning some providers will say yes and some will say no, not necessarily for everybody.
Mm-hmm.
But we'll get into blood pressure then, I guess, because that's what I'm talking about right now.
Mhm.
Blood pressure, just to dial it back a little bit and just talk about what blood pressure is, it is your blood pressure represents how much work your heart has to do to pump the blood to all of your body, to brain and to toes and everywhere in between, right? So the reading has two parts. It has a systolic or upper number that is representing the pressure that the heart is using to squeeze the blood out. And then it has the bottom number or the diastolic number that represents the heart's pressure that it's holding the blood with while it's just relaxed, right? And so you don't want either of those numbers to be too high. It shouldn't take a lot of force for your heart to push the blood out, and it shouldn't take a lot of force for your heart to just be relaxed and holding the blood, right? So a normal reading is less than 120 over 80, right? You don't, yeah. And there's not really a low number that you need to worry about unless you're having symptoms. And we'll talk about that too. An elevated blood pressure, and these are just blood pressure readings that I'm talking about for kind of the general population, including pregnant people, right? Elevated blood pressure, anywhere from 120 to 129 on top, but less than 80 on the bottom, right? Stage 1 hypertension would be anywhere from 130 to 139 on top, and on the bottom, 80 to 89. And then stage 2 hypertension would be anything greater than or equal to 140 over 90, 140 on the top, 90 on the bottom. And that's the number that most of us know to mean hypertension. And that's because high blood pressure guidelines change as well, kind of with time, and different studies are being done and they see what's important and what's not. And so we're paying more attention to people that are between 120, like above 120 over 80, but still less than 140 over 90, because long-term health effects are showing that people with their blood pressure in that range are having some cardiovascular difficulties later on in life. Where if it was below 120 over 80, below 120 over 80, they have less of those issues, right? But as far as like blood pressure or hypertension in pregnancy, postpartum hypertension, and then preeclampsia or eclampsia, and all the different
scary
the continuum of blood pressure issues that you could have during pregnancy. It's the 140 over 90 mark that we look at as being a diagnosis of something. And that's including the postpartum period, right? So the other thing is, like, because of the shifts in fluids, like you mentioned, Valerie, the fluid shifts from the amount of fluid changes when you're pregnant to not pregnant, and where the fluid is changes as well. And especially after birth, like if you had an IV fluids during your pregnancy, which most people who had a hospital birth had IV fluids, then those are a lot of extra fluids that now have to find space. Like you might find swelling in your legs, you might that you didn't have even while you were in the hospital. You come home, now your legs are like this, but that's usually not a problem. It's a scary looking thing. It doesn't usually hurt, but it's not usually a problem. Now, swelling in your hands or your face are another thing. Those can be signs of preeclampsia, and that's a serious disorder of the blood pressure. So I feel like I need to be reeled in. I have gone off on a tangent talking about blood pressure.
We could definitely
remind me of the question.
Okay. I have a specific question. So let's go down this hole too, because with blood pressure, I have a specific question. Then we can come back to lochia. But my specific question is, you're mentioning 140 over 90, that's kind of generally speaking a time where we would be wanting to examine a little bit more.
Yes,
and see a little bit more, right? And so my question is, this is for the folks who are listening who might be wondering this too, would someone necessarily have specific symptoms like headache, dizziness, nosebleeds at that, around that marker? And I'm wondering because, let's say there's someone who is like, nope, taking my blood pressure is going to make me feel highly anxious. I'm not trying to do that. But what can they know to look out for? Or is it that, actually at that range, for some people, they may have symptoms, but for some people, they might. Yeah. So say more on that kind of.
Yeah. So blood pressure is high blood pressure is a silent villain.
There you go. I like
It
that.
has no symptoms,
It
right?
is.
In
Yeah.
general, there are no symptoms, right? A lot of people think like, oh, I have a headache. Let me check my blood pressure. And their blood pressure is high and they think that caused my headache, right? No, your headache probably caused your high blood pressure because pain causes high blood pressure, right? Our blood pressure is not a static number. It increases and decreases whether we're sitting, standing, or laying, whether we're exercising, whether we're asleep, right? It's not just one number. It fluctuates throughout the day. And most of the time when it's high, no, there are no symptoms. If it's extremely high, if it's high enough to cause symptoms, then you are really sick and you need to probably be in an emergency department. So if we're talking a postpartum period, those symptoms would be vision changes, or could be, right? You're not going to have all of these, right? Most of the time, a person will
Typically
not
no.
have all of these. There'll be
Right.
one thing that triggers them to be like, what's going on with me, right? They might have blurry vision or light sensitivity or seeing spots. So those are the vision changes that I mean. They might have a headache that just won't go away. They've taken their Tylenol, taken ibuprofen, right? We're a postpartum period now, so you can take ibuprofen again. It's not going away. Shortness of breath, swelling of the face or the hands, pain in your shoulder or maybe in your upper belly on the right side, really bad pain, or sudden weight gain, right? In the last like 2 or 3 pounds in a week. These are all signs that you might be having like preeclampsia. But with any of those signs, you should be on the phone with a doctor or your healthcare provider that provided you care during your pregnancy, or on your way to the emergency department, right? Like if you really are having a hard time breathing, you don't even have to call. You're on the way to the emergency department.
Immediately.
And let me actually say that an emergency department is not necessarily where you need to be. It's labor and delivery. If you're postpartum or if you're pregnant, it's labor and delivery. Past 20 weeks pregnant for most hospitals, labor and delivery is where you want to go. The emergency department is just going to delay. It's going to delay treatment because though the emergency doctors are trained in a good amount, like they have enough training to help
Yes.
in an OB type emergency, but they're really going to be helping while they're paging OBGYN to come down to the emergency department, right? So they're going to be doing what they can, but you really should be going to labor and delivery for these types of things, even in the postpartum period, because the OBGYNs are the experts on how to deal with these types of issues. So to answer the question, like quickly to sum up, no, there are no symptoms that you should be looking for. Like at 140/90, you likely do not have those symptoms, right? But those are some symptoms that you should be thinking about for the postpartum period.
Yeah.
And as far as like monitoring, right? Like, should we monitor or not? Again, like you said, there might be some people that are just like, if I need to monitor my blood pressure twice a day, every day during the 6 weeks postpartum, I'm going to be a mess. Like, and it's true. Like, it's not necessarily necessary. Now, if you had high blood pressure during your pregnancy, if you had preeclampsia, if you had even postpartum hypertension in the hospital, like right after you gave birth, yes, your OB is probably going to tell you, here's a blood pressure cuff. This is the one I want you to get.
Yes.
It links with our system. Monitor, do all the things, follow what they say. But if you had a normal pregnancy and no hypertension at any point, you probably don't have to monitor at home. Now, that being said, again, this is why I say it's controversial. That being said, again, you can develop postpartum hypertension within like the first 6 to 12 weeks postpartum.
Yeah.
Which again is why I say more frequent postpartum visits
Yes.
are really important for moms, because you don't want to have that added stress of having to monitor blood pressure all the time, right? Like, you have enough to do. You're a new mom. You have to heal. You
sleep
have to
if you
take care of a
can.
newborn.
Yeah.
A lot of you probably have, or might, I shouldn't say probably, a lot of have other kids. You've got families. You've got things to think about that I feel like somebody else should be thinking about your blood pressure for you, right?
Yeah, I would
You pay
agree.
attention to the symptoms that you're feeling,
Yeah,
right? And
and share those.
call or go somewhere if you feel like they're um, out of the normal, you know?
Mm-hmm. Mm-hmm. No,
Um,
I agree.
yeah. So
Okay,
that's
so
blood pressure.
yes,
Sorry, what were you
so
going to say?
let's go. No, yes, I was gonna say let's go to lochia just to because I know it's more of a medical term, so let's break it
Right.
down for our listeners. And then I do have another question, but
Okay.
I'm gonna try to I'm getting excited. So I'm
Yeah.
going to let's start with lochia because I do want to add that because you mentioned it is a vital
Yeah.
sign
Yeah.
to pay
Yes.
attention
Yeah.
to. So let's dive into what that actually is.
So, yeah. So, lochia is the medical term for the postpartum bleeding that you'll have after you deliver your baby. Um, and it lasts about a week or two postpartum. It is going to be heaviest while you're or more immediately after birth, right? And it's actually heavier for women who have had a vaginal delivery than a cesarean section, just because of the way that the surgery is. There's a lot of rinsing of fluids, and so that's you're going to have less bleeding in the immediate time than if you had a vaginal birth, right? Um, because the bleeding happened already. They kind of surgically took care of it, you know? But the lochia, it should never be heavy, heavy bleeding with clots, especially. And if it
Mm-hmm.
is, whether you're in the hospital or you delivered at home with your midwife, if you feel like you're having gushing or anything like that, you let them know, right? You let whoever is taking care of you know that you're having really heavy bleeding. And they'll probably be checking you pretty often anyway. But if you notice anything between checks, you let them know. In the beginning, it's like a dark red, and then it changes to like a pinkish and then a whitish discharge. And so like for the first around day 3 to 5 is where it kind of changes to like red, from red to lighter red or pinkish. And then as the time goes on, it will turn to like a whitish discharge. And then that slowly goes away over the next week as well. And it should never have a smell. It should never have, I mean, blood has a smell, right? But it should never have a foul odor.
Yes.
And the bleeding, you should not be soaking through 2 pads in an hour for 1 to 2 hours in a row. That is hemorrhage. That is too much bleeding, and that is definitely a concern. And even though, again, postpartum hemorrhage can happen, usually, I should say, if it's going to happen, all of these are not very frequent, but when they do happen, they are problems, right? So when they more frequently, postpartum hemorrhage is going to be in the first few days after giving birth, really within even the first day of giving birth. But it can again happen all the way up through 6 to 12 weeks postpartum.
Mm-hmm.
So again, it's important to pay attention to how much you're bleeding, how much you have to change, how often you have to change your pad, and symptoms that you might be feeling about that too. Right. So do you want me to talk about hemorrhage right now or no?
Yeah, well, I was gonna interject with just like maybe a possible tip for new moms out there is maybe putting instead of putting like the whole pad pack in the bathroom, maybe just having a handful or five, and you can say, okay, I'm gonna start with this five for the day or the beginning of the day and see how
That's a
many
good
you
idea.
go through.
Yeah.
And if you
Yeah.
realize, oh shoot, I used all five of those in 3 hours, well, oh no, we've got an issue there, right?
Right.
But it
Right.
could be, with like you were mentioning earlier, thinking about bottles and pumps and this, all this stuff,
Yeah.
it can be easy to lose track of like when you change your pad, everything feels like routine. So
Right.
that could be,
Right.
I know like immediately postpartum, I just had a certain amount in there so I could just keep track in that way.
Yeah, that makes sense. That makes sense. It's a good idea. And it's also another way to think about it would be like, because everybody's going to change their pad at a different time. Like people will have different comfort levels with how much blood is in the pad, right? And when they feel they need to change it. So it's not just like you changed it because you were uncomfortable and you wanted to change it, but like we're talking soaked through. Like you have to change it because your clothes got soiled. You know what I mean? That's too much bleeding.
I love
So
that you quantified it because I'm like,
yeah,
sometimes it is a question of, well, how much is too much?
yeah,
And so I'm
yeah.
like, yes, I like the tip foul on keeping the basket. I
Hmm.
like the quantifying, okay, how many pads am I using? I don't want to say per hour because we shouldn't be using the multitude per hour to begin with, but how many pads am I using in a day? What does that
Yeah.
look like? And I'm like, even for the mommies, I'm like, please remember that you are still healing internally just because tiny one is out, because I'll have moms jump back into their workout routine and it's like, oh, the bleeding has returned. And I'm like, yes, that is a reminder that the uterus is still
Yeah.
recovering.
Yeah.
Your body is still recovering. We do not want to see a reverse in your healing trends. Like it
Right.
might be
Right.
time to dial it back.
Maybe.
Do
Um,
you suggest it for that woman who's ready to jump into their workout routine? Do you suggest like just a lighter routine, like
Oh, yes.
less? Yeah.
Always a lighter routine. I
Yes.
think oftentimes mamas will try to jump right back in or think that they're dialing it back and it's really not so dialed back. And so that's where we come in to say, okay, this is what is appropriate at this stage.
Yeah.
And then you build. And it's usually it's a slow build. I think that's one of the reasons why I actually love working with this population because it's a slow and gradual build. You can start with breath work. We talk about this all the time, Saya and I, but you can start with breath work. You can start with gentle engagement of the core. You can start with using your muscles as you're lifting and bending and squatting and things like that, doing your daily activities. But it's, you know, when we try to, at 4 to 6 weeks, when we try to push and do that
I
extra.
got back to CrossFit. No, you didn't. No, you didn't.
Right. No. So, yeah, we definitely want to slow it down.
Yes,
Good to
there's
know.
so
Good
much
to know.
literature out now on the gradual progressions. I'm like, there's no reason that we have to go 0 to 1,000. It's a
Mm.
gradual, and Val, you're right. There are so many suggestions and recommendations of lighter things that one can do to still build strength. Um, and
I
I
like
do want
it.
to hear about the hemorrhaging. I'm like, this is a hot topic for me, only because I've had one too many people come in, and we end up talking about this at a later point.
Mm-hmm.
Yeah. So postpartum hemorrhage is bleeding that, again, it's much heavier than usual. You're soaking through 2 pads in 1 hour, and that's for 1 to 2 hours in a row. And again, it usually happens within 24 hours after delivery, but it can occur up to 12 weeks after delivery. And like the most common cause is something that we call uterine atony. So atony is like the muscle is not contracting well, right? It's kind of floppy. The uterus is mainly a muscle, right? And so if it's not contracting well, and then, it's a muscle that's pretty much a bag, a muscular bag, right? That looks like this on the inside. And lining the muscular bag is the endometrium. And so when the muscle contracts, it contracts down on the blood vessels of the endometrium or the uterine lining and helps them to stop bleeding. So if you don't have the muscle contraction of the uterus, then it's going to be hard for those blood vessels to contract down as much as they need to stop the bleeding. And that uterine atony can be caused by a bunch of different things too, right? It can be caused, like if there's pieces of the placenta that stayed in during the delivery, that can cause it. If a woman has like blood clotting disorders or a tear in the uterus or in the cervix, which is the opening to the uterus, or the vagina, those can also cause postpartum hemorrhage. So there's a lot of different things, different mechanisms, that can cause postpartum hemorrhage. But no matter the reason, if you're soaking through those two pads for 2 hours in a row, I should say, 2 pads an hour for 2 hours, then you should seek care, whether or not you have other symptoms, right? The other symptoms that might come along with it, though, are low blood pressure, right? Which really you would know by feeling kind of lightheaded, kind of dizzy, just kind of weak. You might feel faint. You might be pale or clammy. These are all signs like you're bleeding too much and your system is like not getting the oxygen that it needs, right? So you also might feel confused. Your heart rate might go up because your heart is trying to pump blood, but it's like not going where it needs to go. So it just keeps pumping faster and faster and faster and faster to keep you oxygenated. And then you might have, like, depending on the reason for it, you might have pain or swelling near the vagina or the perineum, which is like the area between the vagina and the anus. So all of these things are signs that could mean that all of these things are signs that something is wrong, right? But if these are coming along with the bleeding, the heavy bleeding, then that's like, you need to be on the way to the emergency department. Sure, call your doctor if you want to let them know, but you're on, and I keep saying emergency, you're on the way to labor and delivery, right? Like you are on the way. And if you're in the house by yourself, you are calling 911. You're not waiting for somebody to get home. You're calling 911 and they are taking you, because this hemorrhage is hemorrhage. You're losing the blood that you need to live. You do not want that. Like the way that it's treated, once you are at the doctor, you might just need an abdominal massage to get your uterus to clamp down again. And that's usually what is done like in the hospital. In the hospital, if it happens within those first 24 hours, they're going to give you a medication, oxytocin or misoprostol. Those are things that help your uterus contract. They're also used to induce a labor, right? Because they help the uterus to contract. So given at the end of pregnancy, once you deliver that baby, to help the placenta be delivered and to help you to stop bleeding then. But they'll also be given if you're having hemorrhage in the hospital. And so when you go in for this reason, they might give you that medication. They might need to check with an ultrasound to see if you do have pieces of the placenta left in the uterus. If you do, they'll need to take those pieces out. And there's different procedures all the way to like, if it's like you might die if this bleeding doesn't stop and they can't find the reason or they can't stop the bleeding by those other ways, you might have to have a hysterectomy, right? Because they're trying to save your life at this point. And to take the thing out that is bleeding is the only way to save your life, right? So that is the worst case scenario, but also not it's the worst case scenario to save your life, because the worst
to be alive
is the best case is we're alive and we're well.
Exactly.
We've done what we need to do to have
the
that
uterus.
Happen. Absolutely.
Yeah, and there's steps, right? There's a bunch of steps that they would try first. They would give you the medications. They would do the uterine massage. They would put stitches if they saw something was specifically bleeding that they could stitch. They would take out placenta pieces if they were there. There's other surgeries that they can do to help the uterus contract. There's a lot of different things. There's pressure that they can put onto the uterus through a surgery. It's lots of different things. Hysterectomy is the very last thing that they would do if they needed to. But the most important thing is to get seen if you are bleeding heavily.
Absolutely.
Yeah.
And you were mentioning, and we've said this, so I hope someone's taking this down, taking note, but go call your labor and delivery team. So that's, if someone has delivered in a hospital, if if a birth happened outside of the hospital, if there is a water birth at home, or who would be first in line to call? Is it 911? Do we call midwife first? Do we call doula? I think
Right.
in that moment people are panicked sometimes,
Yeah.
rightfully so, but
Yeah.
what numbers need to be on speed dial if it's not labor and delivery because you specifically birthed in a hospital?
Yeah. I would still know if you're birthing at home, a birthing center will usually have some
Connected.
connection. Yeah.
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 That's fair.
But if you birthed at home or a freestanding birthing center, you should still know the hospitals in your close range. And if they, their labor and delivery floor will still, even if begrudgingly, accept a woman who comes in there saying, I just had a baby and I am bleeding.
Yeah.
Bring as much as your paperwork with you as you can. Like, you should hopefully have some kind of paperwork from your midwife that says, like, this is what we did. This is, this is how things went. This is her prenatal picture, right?
Mm-hmm.
And if not, then you should still, your midwife is also going to talk to you about this, right? So like, they'll say, this is the plan if this is what happens, right? They might have their, they are going to have their protocols to deal with postpartum hemorrhage and everything as well, right? They probably have oxytocin. They're delivering a baby. They're not coming into your home without, without the things to help stopping you bleeding. The only thing is they're not in the hospital. They're going to come to your house with oxytocin, probably. I'm saying probably, right? But from what I know, and from midwives that I know of, they have fluids to give you IVs, they have medications, they have the whole nine to deal with any kind of issue. And they know how to call 911 if they can't deal with the issue that they're dealing with, right? And so if you are bleeding out, to be crude, call 911. That's a call. Then call midwife.
Yeah.
I just called 911 because this.
Right.
Because if you're feeling dizzy, clammy, whatever, you can call midwife first, but they're probably going to be like, call 911.
911. Yes. What are you calling me? That part.
Yeah. So definitely they should be called, especially if you feel like you're going to end up in a hospital, because if you don't have a packet of discharge paperwork from your delivery, they're going to need to get that to the hospital as soon as possible so that the hospital knows that you had prenatal care, that you didn't birth alone.
Yeah.
You were cared for, you had prenatal care, you birthed with somebody taking care of you during that birth, because that will change how, and it shouldn't, but it will change how you're treated in the hospital. Unfortunately.
Let's be real.
At least it's honest, though.
Yeah,
But
let's
all
be
right.
real for a second. Like, it's true.
Yeah.
There's provider bias.
Yes.
There's even provider bias of like who you saw for that care, or where you went, even between
Yes.
hospitals.
Yeah.
Right? And so,
Yeah.
and their systems don't talk to each other. And
Right.
again, could go on a tangent, but just know that as many ducks in a row or as much information that you can have to present, the better, right?
Yes.
Yeah.
It's true adulting. It's true adulting here. It's like to the highest level that being
So
pregnant
true.
and having a child brings it all out.
Yeah. It's a wild world. I know that we have touched on, well, not even touched on, did the deep dive for blood pressure. We did the deep dive for lochia.
Yes.
I also just wanted, because I know this is something that can come up as well, when we talk about temperature taking, not just temperature taking, but what are some signs of infection, just so our mommies will know, because I know this can also come up. It's like, oh, I didn't know there was an infection. It's like,
Yeah.
whether it's, actually, let me pause there.
Well, also we want to think about where there can be an infection, right? So if you had a C-section, you can have an infection just in the incision, just in the scar where the sutures are, right? Not the uterus, just the incision. Signs for that would be you're going to be a little bit red around the C-section scar. It's a cut, right? And now it's healing. So being a little bit red, being sore is normal. But it shouldn't be like puffy. It shouldn't be draining. Anything other than like a pinkish fluid, right? Pinkish, whitish is fine. Anything that's transparent, even if it's a little bit yellow, if it's transparent, that's okay too, because that's the liquid part of your blood. It's the plasma that's draining, right? That's fine. If there's pockets of fluid anywhere, if it's really, really painful, if it's red and hot and draining pussy type stuff, that's an infection. Get that checked out.
I like it.
Do you have a fever? It's even more serious. Go to labor and delivery, right? Like where if you feel like something's not right with your incision, you could probably just call the OBGYN. You can schedule an appointment, hopefully soon. They will probably give you an appointment soon if that's what you're saying is the issue. But if you're having fever, that's something else. That could mean that the infection is much deeper and you should probably go in.
That's good to know.
Deeper infections would be like a vaginal tear that's higher up than what you can see, or a uterine infection, which is what we touched on it a little bit when it talked about like the uterine lining, postpartum, or maybe we didn't, endometritis, right? It's the lining of the uterus that can get infected, right? So during childbirth, if any bacteria got in, it's possible that you can have an infection of the lining of the uterus. The way symptoms that would show up with that would be feeling feverish, right? Anytime you feel feverish, take your temperature. You should definitely have a thermometer in the house. Not only are you vulnerable during this time, but you have a newborn, which you need to be able to take their temperature if they're feeling hot to the touch as well. Because newborn infections are very serious as well. No newborn should have a fever. So
that's right.
Yeah. And that's something that you would definitely go to the emergency department for. Any newborn with a fever, emergency department, peds, ED, directly. But that's a tangent. So the woman, 100.4 degrees or above, together with abdominal pain. Now, again, you just had a baby. You had a C-section, you're going to have abdominal pain. You had a vaginal birth, you're probably still going to have abdominal pain because, especially if you're breastfeeding too, that's another reason. As you breastfeed, you are also, your body is letting out oxytocin, which again helps contract the uterus. This is a normal, natural cramping of the uterus that helps the uterus contract back down to its pre-pregnancy state, right? It's a contraction. It shouldn't be the worst pain in your life, right? Because it's a contraction, but you're not pushing anything out. It might be similar to like a period cramp, but it's not going to be as bad as labor pains. Definitely not, right? If you're having just pain outside of like these contractions that you're having when you're breastfeeding or anything like that, abdominal pain, if you press on your lower abdomen, no C-section scar, but you press on your lower abdomen and it's just really sore to the touch, you're having the lochia having a bad smell. All of those things are signs of the endometritis, which is the uterine lining infection. And again, that's a really serious infection that could lead to deeper infections or more systemic infections, meaning like sepsis, which is just like the infection gets into your blood, basically. It can cause death. Like all of these things, the worst case scenario is death. This is why like the maternal mortality rate, especially in certain populations, is high. Right?
Yeah. Because it actually requires a lot of listening on the part of the provider, and it requires a lot of empathy and understanding and belief that what the person is saying is true.
Yeah.
And unfortunately, historically, in the Black and Brown population, that just is not the case in
Yeah.
healthcare. And so that's adds
And
to that
yeah,
maternal mortality rate.
yeah. And on the flip side of that coin, I just lost my word. It requires empowerment on the
Yes.
side of the patient. And a lot of times, because of all the things that you mentioned, we
Mhm.
don't feel empowered.
Yeah.
That's
We don't
true.
And
feel
we
like we
don't
can
feel,
really stand up for ourselves. We don't feel like arguing. We don't
yeah,
want to be the angry Black woman. So we like
right,
stay a little quieter.
right.
And that can be really dangerous. Just like stand up for yourself no matter what. This is, I'm getting
Mhm.
chills because this is the type of thing that I like. One of the reasons that I love dealing with this population, because I really like to give women the information that they need so they can be like, no, I know
Mhm.
this, and this. Pay attention
Mhm.
to me.
Mhm.
Like,
Mhm.
this is
Mhm.
not going to happen to me, not on my watch. So, yeah, temperature is important. It is not something that you need to go measuring. None of these things I feel like are that you need to just monitor all the time, right? If you
Yes.
feel feverish, take your temperature. If you're feeling sick, maybe you don't feel feverish, but you're just feeling bad, like generally bad, right? You're having the clamminess or you're having pain, take your temperature. That's fine.
Mhm.
But you don't need to take it just morning, noon, and night just to
Mhm.
check and make sure. Unnecessary. 100.4 degrees Fahrenheit is a fever. Get checked out. Even if, like, if you're not feeling any of these pregnancy things, but you have a cough and a cold, or, cold symptoms, go to the urgent care. Maybe you have COVID. Maybe you have the flu, right? Like, these are
Yeah.
still important things to take care of, right? Just because you just had a baby, it doesn't mean everything is going to be baby related and postpartum related, right? You could
Right.
still just have a regular, nah, it's
Ailment.
serious still, the flu, right?
Yeah. Mhm.
Um, but just get checked out if you are sick. Yeah. And have a thermometer. Have a thermometer at home.
Mhm.
Dr. Sha'llah, thank you so much for for the detailed overview. I'm like, okay, 100.4, the blood pressure, 140 over 90. I'm like, I love the
Yes.
numbers. I love the specificity because I don't like to wonder. Dr. Val knows. I need to know yes or no. What specifically are we doing? What
That's
is the
right.
game
What
plan?
is it? What
If
is it?
A happens, yes. Then
Yes.
B is this. What is C?
Yes.
And I was like, I love your passion. I love your knowledge and your heart for women's health. Can you tell us a little bit about your business and how we can find your services in Maryland?
Well, SBMD Healthcare is my private practice. It's a culturally responsive primary care GYN home that centers like the unique healthcare needs of Black and Spanish speaking patients. Um, we operate from a reproductive justice framework, providing unbiased, patient centered, and trauma informed care. And the part that is pertinent to this conversation is the baby and me postpartum care. So it's in-home postpartum care that it's actually postpartum and newborn care services, actually. So I visit families at home to care for both the baby and mom together. And that just means earlier check-ins for maternal recovery, mental health screening, feeding support, and well baby care without the stress of travel. The and you wouldn't. I do want women to still see their birthing provider, right? So at that 6-week visit that they would have, they should still have that. I still want the children, the newborn, to see their pediatrician. At their 1-month visit, they should go to that, right? But I am there to help bridge that gap between the time when you gave your baby and the visit that is scheduled with your OBGYN. And it's the details about it you'll be able to find more information out at the contact that will be linked below. Yeah.
Oh, yes. Everything will be in the description. As we were talking, I was like, shoot, I want to sign up for her services when it comes to postpartum, even prenatal. It's nice to have the extra touch point, especially with the not the standard, but when the current practices are looking more like 6 weeks versus the couple of days after.
Right. And it's just, I would have loved, I actually did have for myself when I had my child, I had the first newborn visit in home. It was wonderful. I didn't have to go anywhere. They brought a scale to weigh the baby. They did the measurements. They did everything that they would have done if I brought her to the office, and they did it in my house. So I didn't have to go out of the house. What is it, like 3 or 5 days after the baby was born?
Yeah,
right?
It's usually about 3 days after the baby is born. It's like you don't know up from down, and you're out here in the world.
Right. And so I just really, I trained that way. I got that service for myself. I wanted to be able to give that service to the women that I take care of. So that's why this is a thing.
Amazing.
That, along with all the things that we just discussed, all the things that could be missed within that first 6 weeks, if that's all that you have as a visit.
Yeah. Well, listen, Maryland mamas, look out for Dr. Sha'llah. She is doing amazing things with SMBD healthcare and SBMD healthcare. She's doing amazing things. We can hear the passion. We feel it. It is definitely clear that you are all about helping moms, specifically with the baby and me, but women in general with your services, sustain their most thriving and balanced selves. So mamas out there, stay balanced. We will catch you next time on the Balanced Momma Project Radio. Thank you so much.
This was wonderful. Thank you for having me.